Former Vice President Dick Cheney and heart disease. Former Vice President Dick Cheney missed campaign events in 2008 because of atrial fibrillation, according to the Wall Street Journal, and in 2009, ventricular fibrillation caused sudden cardiac arrest. His heart rhythm was restored with an implantable cardioverter defibrillator, ICD, that gives a short electrical shock to the heart. Cardioversion is a reasonable way to restore normal heart rhythms, explains Campbell. However, over time, atrial fibrillation begets atrial fibrillation. In other words, the more AFib you have, the harder it is to control. Most physicians will begin to use drug therapy in patients who have recurrent atrial fibrillation after multiple cardioversions. The strategy is to use drugs to help maintain normal sinus rhythm once cardioversion is performed. In 2010, Cheney needed a surgically implanted, electrically driven pump called a left ventricular assist device, LAVD, which replaced his heart's normal functions until he received a life-saving heart transplant. Former Prime Minister Tony Blair and SVT Matt Rourke, Associated Press 11. Former Prime Minister Tony Blair and SVT. Former Prime Minister Tony Blair of the United Kingdom was diagnosed with supraventricular tachycardia, SVT, in 2003, reported BBC News in 2004. His condition was treated with cardioversion, but he eventually underwent a catheter ablation procedure to cure him from having SVT in the future. Catheter ablation is first-line therapy for the treatment of most SVTs, says Campbell. Physicians make the decision to perform ablation based on data obtained from the EKG and monitor strips. Using these, an MD is able to make a good guess as to the location and mechanism of the tachycardia. Then the physician can have an informed discussion with the patient and advise them of the options for therapy.